Hi, my name is Adam. I'm going to be your nurse today. We're going to take your full vitals today. Before we get started, can I please get your full name and date of birth?
Vanessa Sanchez, and my date of birth is 4/21/91.
Okay, perfect. I'm just going to go ahead and check your wristband here. Okay, perfect. Looks good. Before we get started, I'm just going to do my hand hygiene over here. I'm going to check my environment, make sure that there's your bed's in lowest position, nothing on the floor that we can trip over. So first we're going to get started here. We're going to get started by checking your temperature. So first we're going to take your temporal temperature. It's going to go from your left forehead, going to go across, perfect, going to go behind your ear. Okay, reading is 98.7, it's within normal temperature. Next, what we're going to do is we're going to check your blood pressure. So I'm going to use this manual blood pressure cuff here. So we're going to be using your right arm here. So this cuff is going to be wrapped around your right arm. Make sure it's nice and secure. And then we make sure when we place the blood pressure cuff that it's lined up with your right brachial artery. And then we can clearly read it from the sphygmomanometer there. Okay, so before we get started, we just want to make sure that your feet aren't crossed. Sit up nice and straight for me. We're going to place the diaphragm of the stethoscope right underneath the brachial artery here so we can get an accurate reading. Just go ahead and relax your arm for me. Perfect. And then we're going to pump it up to about 200 for this patient here. And then as soon as we start to hear the first love, that's where we're going to place, where we're going to count our systolic blood pressure. Okay, so we're hearing the first love at 120. Okay, and then it stopped at 60. So the patient's blood pressure is going to be 120 over 60. Within normal range for you. Perfect. Alrighty. And then next I'm going to get your pulse. So for this one we're going to take your pulse right here on your right radial pulse here for 1 minute. Okay, so as I'm taking the patient's pulse, we're going to listen for about 30 seconds. If the pulse is regular, then we're just going to multiply that times 2. So at 30 seconds, let's just say we got to 30, we would just multiply that times 2. Patient's pulse would be 60. And then for the remainder of the minute, we're going to get the patient's respiration. So we're going to go a little bit over the full 1 minute mark and we're going to get the patient's respirations without the patient knowing. We're going to check for the chest rise and fall, make sure that's nice and normal without using any accessory muscles. We won't tell the patient this because we don't want them to alter their breathing. Okay, perfect. So the pulse was at 60, respirations were at 16. Are you currently feeling any pain at the moment?
No.
Okay, perfect. So that's it for our vital signs. I'm going to go ahead and report this to the doctor and just let us know if you need anything, okay?
Thank you.
Great, thank you.